Hello, and a warm welcome to this episode of Let's Talk About Our Health Partnership. Today, Clair Huckerby, OHP's Chief Consultant Pharmacist, reflects on OHP's role in securing £475,000 of funding to improve cardiovascular care in Birmingham and Shropshire, and how this has benefited its member PCNs and their patients.
Cardiovascular disease is a general term for conditions affecting the heart or blood vessels. So cardiovascular disease is one of the main causes of death and disability in the UK, and in Birmingham and the Solihull area in particular, the prevalence of coronary heart disease is one of the highest in the country. So we were really fortunate to learn about the opportunity to apply to Daiichi Sankyo for a Detect, Protect and Perfect initiative grant. This was the first grant that we'd managed to get for our practices, and I think our practices and our primary care networks were really pleased and excited because it gave them the opportunity to do something slightly different, particularly thinking about going out to communities and doing screening and so on, which they might not have been able to do without this funding. We were able to provide sort of coaching and mentoring as practices were developing their own projects. We were able to advise on procurement of some of the kits and also training as to how to use the kit. We provided webinars and so on. And again, doing that at scale is much more efficient than doing it one practice at a time. Our patients now have got a wider access to diagnostic technology, improved access to healthcare professionals, education and support, and also the self-management. And more and more now we're seeing that patients are wanting to take an active role in their healthcare. This project's created valuable momentum across the organisation for clinicians to plan further enhancements. It's created opportunity for continuing community engagement work and also potential for research in this area. One of the most important outcomes of this project is the key benefit from the central leadership and how we've developed those support tools, education for at-scale delivery and shared learning across our partnership. I think without that central coordination, practices would have found it very difficult to, access such a grant and then to think about how they were actually going to deliver it.